Thanks so much, Amanda. Yes, thanks for having me here today. My name is Eileen, and I am the Waiver Innovation Unit Supervisor at the Office of Community Living. And I oversee the Children with Complex Health Needs Waiver project, along with the Wellness Education Benefit and Community First Choice. So 3 new changes coming your way. Well, the web isn't that new. You all probably know about the web already, but Community First Choice and the new merger are coming in July of 2025. So I'm excited to be here and starting training for the new waiver. So today we're going to be going through just the overview and background for this new children's waiver, the Children with Complex Health Needs Waiver. And I'll be referring to it as CwCHN throughout this training, just to make it shorter and easier on the ears. And then we're going to be going through some enrollment and eligibility information. But I will say, ultimately, a majority of those details, such as system details, will be coming in March, as you will do kind of CFC systems training and CwCHN systems training at the same time, since some of those pieces are linked. We're going to go through documentation and service planning, and then finish up with case management roles and responsibilities. So after today, we're really hoping that you're able to describe the CwCHN waiver to members, understand what it is, why it's happening, and the services that are on that waiver. And we also want you to be able to state the steps for enrollment onto the CwCH waiver. And last, we would like to make sure you feel confident building and coordinating a CwCHN person-centered support plan. Okay, so what is this new waiver, and why are we implementing a new waiver this summer? So the Children with Complex Health Needs Waiver is essentially a combination of the current Children's Home and Community-Based Services Waiver and the current Children with Life-Limiting Illness Waiver. So the CwCHN waiver is basically the CLLI waiver that will open up with eligibility criteria to allow CHCBS kids to enroll, and it'll be retitled as the CwCHN waiver. So it's a merging of the CHCBS waiver into the CLLI waiver, rather than like a combination of the two under a new name. That's how I prefer to think about it. And I think that's kind of more accurate when it comes to what's happening on our systems, on the back end. This new waiver will include all the same services as the current CLLI waiver, with the addition of the wellness education benefit. So you're probably asking, why are we doing this? Why are we essentially, kind of eliminating CHCBS as a waiver and enrolling these kids into a new waiver program? So the Community First Choice, as I'm sure many of you have heard about it. And I won't go too much into it during this presentation, but it's a big state plan program that's launching in July 2025. And it's allowing us to move a handful of HCBS waiver services from those waivers to the state plan. And when they're on the state plan, they're going to be available to not only eligible members on the state plan, but to all waiver members, regardless of the waiver that they're on. One of the services that we're moving over to Community First Choice, to the state plan, is in-home services and supports, health maintenance activities. And that is just one of 2 services that's currently on the CHCBS waiver. So when that happens, CHCBS will only have the wellness education benefit on that waiver, which isn't really allowed. Our federal partners, the Centers for Medicare and Medicaid Services, don't really like states to operate waivers with just one service. So in preparation for this, for CHCBS to only be left with one service, we decided as a department several years ago, how about we just merge the existing CHCBS waiver population with the current CLLI waiver population and retitle it to, better reflect that new population of combined children. So that's what we'll be doing. And it's very exciting because it'll not only prevent CHCBS members from losing their waiver program services, but that it'll also allow them to have access to additional services through the waiver and through community first choice. And we'll get into that a little bit more in the training, but with community first choice, no one is losing services. No waiver members are losing services because those services are moving off the waiver. They're just going to be accessible under a different program. Again, we'll get into that in a little bit, and then it'll all become more clear when you take the CFC training in March. Okay, so some of the key benefits are we're streamlining the HCBS children's waiver programs, which is exciting. One less waiver to keep in your brain, because I think Colorado has maybe the most waiver programs out of any state in the US. So, we're always looking for ways to simplify and streamline our waiver system. The eligibility criteria will be expanded to capture both the CLLI and the CHCBS waiver populations. And then services to CHCBS members will increase, and services available to CLLI members will remain the same, but they'll have the option of the wellness education benefit. So no one's losing services. Everyone's just gaining access to more services if they need them and if they, desire those services. Okay, so effective 7/1/2025, the services that'll be on this new CwCHN waiver are going to be the same services that exist now on the CLLI waiver. We're not changing anything about these services. We're not changing the definitions, the unit limitations, the rates, the provider requirements. Everything about these services and the way that you authorize them is staying the same under this new waiver title. So you don't have to worry about, anything changing with these services under this new waiver. We have bereavement counseling, expressive therapy, massage therapy, palliative and supportive care, respite care services, therapeutic life-limiting illness support, and the wellness education benefit. And I'll also note here that, the intent of this waiver too is staying the same for those CLLI children. So, CLLI children can still access benefits on the state plan and their waiver services at the same time. That is changing. So, children can access hospice, for example, and continue to access all their waiver services. Okay. So again, there are no provider changes. The CwCHN waiver will use the same provider specialties. So there's nothing providers will need to do differently to continue to provide their services. And IHSS services for those CHCBS kids will be accessed through CFC. So CHCBS members are not going to lose access to IHSS. They're just going to receive that service under a different authority, under the CFC program instead of under waiver. And if you have any questions about these services, if you're new to them, if you're new to authorizing them, please feel free to visit our CHCBS and CLLI website that we have linked in this training. Those websites have the services and the service definitions outlined there. And you can also look at our rate sheets Those have unit limitations and modifiers as well. And so those can be very helpful, and those are found on our HCBS rates page. Okay, so the services that we're moving over to Community First Choice, just to kind of take a pause and highlight these for a minute. We are moving homemaker, personal care, health maintenance activities, remote supports, home delivered meals, transition setup, and electronic monitoring. In addition, we are moving consumer directed attendance support services and in-home support services over to CFC as well. So members, regardless of the waiver that they're on, will be able to access any of these services as well as CDOS or IHSS if they're interested, and if they have a need for those services. So really exciting. We are expanding access and options for care under this new program. And so children on the CwCHN waiver will be able to, access homemaker or personal care, for example, if they need and want that service. And they can also explore CDOS or IHSS if they want. And so, it really kind of streamlines the process for accessing these benefits. You don't have to be on a certain waiver to access CDOS, for example, anymore. You will just be able to access it regardless of the waiver that you're on. Okay, and then this chart here kind of shows the current state on the left-hand side of the slide, going into future state on the right-hand slide. So right now we have the two children's waiver programs that we're talking about today, the CHCBS waiver and the CLI waiver, with the benefits listed in each of those boxes. And then come July of 2025, we have the new waiver, the Children with Complex Health Needs Waiver, and services available under that waiver. And we have Community First Choice with all of those services. So again, come July 2025, members on the CwCHN waiver will have access to all of these services if they need them. So again, expanding access and expanding options for those service delivery models. Okay. So now we're going to get into eligibility, documentation, and service planning. So the first thing we'll go through are just the previous requirements for CHCBS and CLLI. So previously, or currently, I should say, currently the CHCBS criteria that a child must be under 18. They have to live at home with their parent or guardian and choose to receive services in the home. And they must meet a skilled nursing facility or acute hospital level of care. They have to meet that federal SSI disability determination. And then they also they're subject to the parental income consideration. So, I'm sure many of you are familiar with the fact that CHCBS has a unique and funky financial eligibility requirement where the child is not otherwise eligible for Medicaid benefits or enrolled in Medicaid waiver programs due to parental income and resources. That piece is going away under the new waiver, which is very exciting. And I'll hit that again in the coming slides, but this is a question we are asked often from our stakeholders. So we definitely want you as case managers to know this piece and be able to answer questions when stakeholders or members ask. So the child's resources are the only resources, the only income and resources that will be considered for the new waiver. This parental income piece, that's going away. So what we're doing is we are aligning the financial eligibility criteria for the new waiver along with all the other children's waivers. So that's very exciting. It'll just expand access for families as the child's income is going to be the only financial consideration. Here is the current or previous in the context of the new waiver, but the current CLLI targeting criteria. So right now, children to be eligible for the CLLI waiver need to be under 19 years of age. They must meet hospital level of care, and they must have a diagnosis of a life-limiting illness that has to be documented on a specific physician attestation form. They must live in their home, and the income and resources of the child don't exceed 300% the current maximum SSSI allowance. So these are the current CLLI targeting criteria. Okay, and then we'll go into the next slide here as this covers the merged waiver criteria. So in order to accurately combine both of these eligibility requirements, we made sure to expand the age limit to the higher age of the two waivers. So that's under age 19, which means the child will age out of the waiver on their 19th birthday. A member can still transition out of the CwCHN waiver at age 18 if they so choose. Okay, next slide. And then as far as level of care goes, for the new CwCHN waiver, a child must meet either nursing facility or hospital level of care. So we're not restricting it to the skilled nursing facility or acute hospital level of care. It'll just be nursing facility or hospital level of care. And for nursing facility level of care, for that pathway, there's no additional targeting criteria that a child must meet to be eligible for the waiver. So they must have needs that are similar to that of a child in a nursing facility requiring the services every 30 days in oversight of a physician. I'm sure you're all very familiar with the nursing facility level of care, so I won't go into that too much, but that is going to be one of the pathways for the waiver. The other is hospital level of care. So the child's needs are similar to that of a child in a hospital. They have acute needs or their condition is unstable and predictable. To meet hospital level of care, a child must have either a diagnosis of a life-limiting illness, or they must have a condition of complex health needs, which is, and Amanda, if you want to pivot to the next slide, the points on the bottom, perfect, yes. So again, to meet hospital level of care, the child must either have diagnosis of a life-limiting illness or they have complex health needs, both of which or either of which need to be documented on a physician attestation form. The physician attestation form will be similar to the children's life-limiting illness attestation form that is used now for that waiver, but it'll be retitled and revamped a little bit to include a space for physicians or licensed medical professionals to attest that a child has a complex medical needs, which are evidenced by one of the three criteria at the bottom of the slide. So they can either be technologically dependent for life or health sustaining functions. They may have complex medication regimens or medical interventions, or they may be in need of ongoing assessment or intervention to prevent serious deterioration of health status or medical complications that place their life, health, or development at risk. So all that being said, This form is not necessary for eligibility for the waiver, but it is necessary for a member to meet hospital level of care. So members, we are, I know this question has come up a couple times in training over the last 2 days. We'll kind of go through it over the next couple of slides. But essentially, you're probably wondering why bother with this form when a member can just meet nursing facility level of care and we don't need to bother with this form. And the answer to that is this form is really important for you and for us to make sure that we're documenting children's complex health needs appropriately on this form and in the 100.2. So, if a child has needs that are more appropriate and align more with a hospital level of care than a nursing facility level of care, perhaps they have more complex health needs that maybe don't require significant ADL support. That's really important to be documented on this form and then appropriately documented in the 100.2. But, essentially it's necessary for us to kind of maintain our documentation and ensure that, you have all the right information in the right place. Okay, next slide. So financial eligibility, I'll just touch on this. So again, we are aligning the financial eligibility for this new waiver with all the other children's waivers. So the income and resources of the child shall not exceed 300% of the maximum Social Security insurance allowance. So you will use, as case managers, you'll use Peak Pro and CCM to verify financial eligibility determined by eligibility sites, same way that you do now. The child must also have the federal SSI disability definition or is an SSI recipient. And again, this is not the same thing as the developmental disability determination. So just to make that clear, they don't need the developmental disability determination for this waiver specifically. Okay, and then a child can also be an optional state plan recipient. That is another pathway for this waiver. They could, potentially be presumptively eligible or trails or foster care programs, and those groups are eligible. They're optional state plan recipients and may be eligible for this waiver as well. Okay. All right, so back to the documentation in the 100.2. So again, I'm sure you're all very familiar with this, but just to reiterate, to qualify for long-term care services for waiver programs using the Legacy 100.2, the child must score in at least 2 of the 6 ADLs and at least 2 in the behaviors or memory cognition. And then, case managers are going to follow that same process for this waiver and must demonstrate the criteria for this new waiver in the 100.2. And they must only document and score the needs of the child and what caregivers do that are above and beyond the needs of children of the same age. So same age appropriate guidelines apply to this waiver as you're going through the 100.2. Okay, next slide. Okay, so information regarding complex health needs should be documented in the corresponding ADL impacted by the condition, and you need to specify the necessary support. So we have a couple examples here on this slide. The first one be if the child requires a G-tube, then you're going to document this in the eating ADL. It could also be documented in the bathing ADL. So you'll use your best judgment there. And then the second example we have is if the child needs ongoing multiple respiratory treatments throughout the day. This could be documented in the transferring or mobility ADLs, and you'd explain how these treatments impact the child's ability to perform those activities. So overall, you'll need to document the medical condition, how it affects the ADL, and how it makes the child unstable or fragile. And it's really important that you understand the child's diagnosis, their condition, supports that they're needed, that are needed, and to really capture why and how the child would decompensate significantly if they did not have the level of assistance that they need. Okay, and then the last reminder on that slide I just want to touch on is that you cannot only document complex health needs within the narrative and score of the memory cognition section of the 100.2 unless they only specifically impact the child's memory and or cognitive functioning. Okay, back to the form. So the PMIP and the physician attestation form. So for current CHCBS and CLLI members who are transitioning to the CwCHN waiver, we're not going to require them to have a new PMIP or physician's attestation form. Just because we're implementing a new waiver, we don't want to make it more burdensome for our members and to have to get a new PMIP. So that is not necessary for current members. For new members, however, they will require a PMIP and they will require a physician attestation form. The physician attestation form, again, is only necessary if members are meeting hospital level of care. So ideally, you would have the form back from the member before filling out the 100.2, but we know that's not always the case. So in the event that you hold the 100.2 prior to receiving the PMIP and the attestation form, don't hit complete on that yet, because you're expected to then come back and use the information in the attestation form and any other supporting documents to elaborate on the child's condition, how it affects their ADLs and supports, and confirm the child's level of care prior to the 100.2. So if you get the form back and the physician has attested that they either have a life-limiting illness or have complex health needs, great, you'll update your 100.2 and it'll be indicated that the child will need a hospital level of care and they can be eligible for this waiver. If you get the form back and a physician has not attested that a child has a life-limiting illness or complex health needs, that's okay. You can still go through the 100.2 and see if they meet nursing facility level of care. If they do, great, they can be eligible for the waiver. So, if you get that form back, we really want to make sure, even if a physician does not attest, it doesn't mean you stop and you're done. Please go through the 100.2 and ensure that the child does not meet nursing facility level of care. Okay. So we'll go over some possible conditions and supports next. So individuals or children on this waiver who have complex health needs will generally exhibit any combination of the following, but not limited to what you see on this slide. So this isn't a comprehensive list, but it is just a few examples of what you may see from children on this waiver. They may have massive sensory deprivation, severe motor dysfunction. They may be immunocompromised or awaiting organ transplant. They may have neurological or degenerative diseases, congenital or genetic disorders. They may have uncontrolled seizure disorders, and of course, they may have a life-limiting illness. Okay, and then for possible supports, individuals or members who are eligible for the CwCHN waiver may be receiving or require some of the the supports on this slide. Again, this is not an exhaustive list, but it's just an example and just to give you an idea of the needs you may see. I'm not going to read through all of them, but you could see members who wound irrigation and drainage, positioning and skin integrity management, intermittent positive pressure breathing, suctioning. So, any number of these services could indicate that a child needs or meets eligibility for this waiver. Okay, and then we'll go over some member goals. So the goals for these members should be developed in the same way that you do for all your HCBS waiver members. They should prioritize the members' preferences, aiming to enhance joy, fulfillment, and increase independence. So they need to be tailored to the members' specific needs and demonstrate their benefits. And for any members, any children who are unable to communicate their goals or they're too young to express their own goals, you can work with the caregiver and the parent to help identify the child's goals. Okay, and on the next couple of slides, we have some examples. The first slide goes over some inefficient goals that we would not like to see. These are not robust enough. They are not detailed enough and don't really tie to the members' preferences in the way that we would like to see. So we have the child wants to continue to live at home. They want to be more independent, or they would like to see the child increase his coping skills. So we would deem these as not sufficient enough for the members' goals. And on the next slide, we have a good example of members' goals. So these are for independently communicative older children specifically. So the first one would be Olivia is focusing on staying healthy and having as minimal hospital visits as possible because she wants to be able to go to Disneyland with her family. The second is Austin is helping with different chores to save up to buy a new Xbox. And the last one is Tony wants to be able to go to the mall with her new friends. Learning how to ride a bike will help her reach her goal. Okay. And then I think we have one more slide on goals. So this this slide are good examples for younger children who are dependent on others for communication. So Madison wants to be able to reach her toys independently. Being able to crawl will help her reach her goal. Antonia wants to be able to play with her siblings. Being able to sit up on her own will help her reach her goal. Javier wants to take walks with his dog. And then Luke's goal is to have a friend. Being able to stay healthy enough to attend school regularly will help him have more interaction with his peers. Okay. So now we're going to pivot to some systems talking points. So I'll just say before we get into kind of this last section of the presentation or the training today, that more detailed system training on this waiver and on CFC will come in the next several weeks with CFC systems training. So what we'll tell you today is kind of more of a primer, an overview, but we'll be able to provide more details to you closer to the end of March when we have our CFC systems training. So overall, members on the CwCHN waiver will not use the pending targeting criteria status, as this targeting criteria is not a requirement for CwCHN. And then you'll enroll CHCBS members into CLLI from April to July for July 1 start dates and later. So this is really important because you will not create CHCBS PARs for July 1 start dates and later. So the reason for this is on July 1st, 2025, the CLLI waiver will experience a name change to CwCHN. But before that, in our system, the CwCHN name will not appear. So from April to July, when you're beginning assessments for your CHCBS members who have July 1 start dates and later, you're not going to see CwCHN. You'll just enroll those members into CLLI, because then on July 1, they'll experience the name change and they'll already be in CwCHN, so to speak. So you're kind of working ahead of the system's name change, if that makes sense. The important thing to remember is that you're not going to create CHCBS PARs for July 1 start dates and later. And then again, CLLI will automatically change to CwCHN in the bridge and CCM. There's nothing that you have to do for those members. Okay, and then as far as service planning goes, so for CHCBS members who you're conducting CSRs for, the Telegen review submission will be through June 13th, 2025 for IHSS. The new nurse assessor process will begin in July of 2025. Again, more training on this will happen in the next couple months, but there will be a small gap from June 13th to July 2025 for these members. So we really are, kind of stressing that you should work ahead to make sure you have your July 1 start date IHSS reviews submitted and approved for PAR creation at the first half of June to avoid any delays or gaps in service. If you do fall within that gap, we would just ask that you hold your review until July 1, so it can be submitted to the nurse assessor instead. And then following July 1st and later, the nurse assessor will be the process for how skilled services are reviewed. And again, IHSS will be on CFC, and there's not going to be a Telegen review anymore for the new waiver. So just know that, when you're enrolling members into the new waiver, newly enrolling members, you won't need to submit to Telegen. Okay, and then again, for CHCBS members, at the time of their CSR, you'll be able to talk to them about new services that are available to them, either on CFC or on the new CwCHN waiver. So, if they need respite care or if they want to continue using the web, which we recommend, then you can add those to their service PAR. And then for CLLI members at time of CSR, they'll be able to access CFC. So just know at CSR, you'll be able to discuss any new CFC service options with the member at that time. Okay, so case manager roles and responsibilities. So again, you'll need to enroll current CHCBS members into the CLLI waiver for members with July 1st start dates and later. And you will not create CHCBS PARs for July 1 start dates and later. So you'll enroll them into CLLI from April to July, and then on July 1, the CLLI waiver will experience that name change. From July 1 and later, for any members who are newly enrolling, you will just enroll them directly into the CwCHN waiver because it'll have that new name change at that point. But before July 1, you are not newly enrolling anyone into the CwCHN waiver. Newly enrolling members will need that physician attestation form as well for meeting hospital level of care. Okay, and then overall, your case manager responsibilities, as far as intake, referral, utilization review, person-centered support coordination, all of those responsibilities that you have for your waiver members, those are not changing under the new CwCHN waiver. So you'll continue doing all of those things you do now. Alrighty, so now we just have a couple more slides to wrap things up. So we'll go over the transition year overview one more time. So starting on April 1st, again, you will begin transitioning current CHCBS members who have July 1 start dates and later into CLLI. And then on July 1, that CLLI waiver will experience the name change. At that time, you can also begin initial enrollments into CwCHN. And again, you will not create any new enrollments for CHCBS or CLLI. So you'll just be enrolling those members into CwCHN. You'll have a year from that point, from July 1st of 2025 to June 30th of 2026, you will have a year to enroll all current CHCBS members into the CwCHN waiver at their time of CSR. So at CSR, you'll enroll CHCBS members into the new waiver and into CFC, where they can access IHSS. On June 30th of 2026, the CHCBS waiver will close. So it is imperative that you have all the CHCBS members successfully transitioned by that date. All right, and then the main takeaways. So again, the new waiver will be live officially in July 1st of 2025, when you can begin new enrollments. The CHCBS waiver will close June 30th of 2026. The new waiver will combine both the CLLI and CHCBS eligibility requirements to capture both of those waiver populations. And the CLLI waiver will remain in existence, but it's going to experience a name change on July 1. And then case managers have that entire
Eileen, I can't hear you. We lost your audio, but we can see you, so you're not frozen. Your audio just turned off. Did you? Can't hear you. Oh,
what about now?
Now, yep, we got you. We got you. Thank you. Sorry about that.
No problem. I'm just glad I made it mostly to the end without an issue. Yes, so I think the last bullet there was just that you'll have an entire year to enroll all CHCBS members onto the new CwCHN waiver. On June 30th of 2026, the CHCBS waiver will close. Okay, I think that is all that we had. So I love to answer any questions that you have that Aubrey has not already answered in the Q&A. But yeah, feel free to come off of mute if there are any questions that you have.
Have to raise your hand first, so just raise your hand. But we do have 2 in the Q&A if you want to tackle those first. And then give me a chance to unmute anybody who raises their hand.
Eileen, I'm not sure if you heard Amanda, but there's 2 in the chat for you.
Okay. In the chat or in the Q&A?
Sorry.
In the Q&A, I'm sorry.
Okay. Yeah, no, you're good. I think I was in the chat. Oh, I didn't see anything. Okay. Great. So the first question I see is, we end up having a lot of children trying to access current CLLI services, but there are limited providers and kids end up on wait lists. Now that CHCBS kids will have access to these services, will we have more providers? That's a great question. So we are working with our COBS team to kind of, prep providers for this change and do some provider recruitment. We, will get more information to you as it comes. But, we know that that's an issue. A lot of members and case managers and providers have flagged. So we're going to kind of stay on top of that and monitor it as we launch this new waiver. And then the second question I see is, so it's okay that the CHCBS, although they will be enrolled in the CwCHN waiver on July 1. For example, if a member has a start date of July 1 for the new plan year and this SC completes the assessment in May, the assessment dropdown would say CHCBS, since the CwCHN dropdown will not be available. So I think you are correct. It's except for you're replacing CHCBS with CLLI in your statement. So if it helps, essentially you're enrolling CHCBS members into CLLI for July 1 cert dates. On July 1, actually, the CLLI waiver will experience that name change. So, you're enrolling them into CLLI from April to July just because the CwCHN name has not yet appeared in the system, if that makes sense. Okay.
We still have 30 minutes or so, 40 minutes left in this training. Anybody want to raise your hand, come off mute to ask a question? You can also still submit them via the Q&A, but happy to take more questions.
Eileen, there's also something I was wondering if you could follow up for Winter in the answered part of the Q&A. She had asked about the targeting criteria in the HMA document, and I had responded about the attestation form, and they had responded back, and I was wondering if you could follow up with that as well.
Sure. Okay, let me get to that really quick.
Like, see if you can find it first.
Okay.
It's from Winter.
Okay, the HMA documentation guide currently has respiratory going under a different ADL than that was on the targeting criteria slide. It currently says, my question is, how does this mean, or does this mean now we have different HMA documentation guide or continue to put info into the current guide? I am not familiar with the HMA documentation guide, so I hesitate to answer this question, but we can certainly touch base with our COBS team and get back to you on that. But I think that question ultimately might be better saved for when we do CFC training, because HMA is moving under CFC, and we'll be doing the nurse assessor process as well. So I want to make sure you're getting the most accurate and up-to-date information on HMA, and that training is more appropriate since HMA is not going to be a waiver service after July 1.
So, I wanted to ask, and obviously you just mentioned like the CFC training is coming up, so there might not be an answer to this, but it's new for us now to be able to have people, they're going to be dual enrolled, basically, correct? For CFC and this waiver if they wish.
Correct.
Do we know if cert periods are going to be the same for
Yes.
these? Okay, because that would be a nightmare. So
Yep. Same cert period, one PAR, one service plan, one person-centered support plan, everything aligns for these two programs. Because our intention is that your service planning for CFC and the waiver together, because the services, need to be coordinated together. So,
If
um,
someone just has, so I have some clients right now on the kids waiver that don't have IHSS, but if they decide that they would like a service on the CFC waiver, but it takes them a couple months to decide that, is that okay? Can we add that waiver in those services later, or do they need to make that decision like at the annual cert period so that we can dual enroll them?
that's a really good question. And I don't want to get too into it now, but ultimately, I would really stress to the member to make that decision at their cert period, because it is going to be much easier, for you and for them to do everything at the certification period, because everything does need to align. But we will have more kind of detailed examples and guidance for you during the CFC systems training for those scenarios. But I can at least just tell you now that I would really recommend, to your member to make that decision, at that CSR meeting, if possible. Okay, I see some more in the chat. So I'm gonna look at these. If we have someone on CLLI that wants to transition to IHSS prior to July 1st, do we just do a waiver to waiver? Then when their new service plan is going to start, we could change it to CwCHN or CLLI again. So if I'm following this one correctly, so I would say first that a member on CLLI is not going to be able to access IHSS on CFC prior to July 1 of 2025. So for CLLI members, they can enroll into CFC and use IHSS, at their CSR July 1 and later. If that answers your question, I'm not sure if that does, but feel free to follow up if you have more clarification on that one.
Sounds like they're already on, right now they're on CLLI, but they want IHSS.
Okay.
So they're saying, would we transfer them to a different waiver and then move them back to CwCHN in July?
Yeah, Carol and I had one on our side too that was kind of asking the same thing, like, oh, well, would we do a waiver swap now to the CHCBS waiver and then just kind of be a part of the merge in July, like we're going to be, but instead of already being on CLLI, we'd be on the HCBS for the IHSS. And we basically told them that if possible, unless it's like an urgent thing, just to wait until 7/1 because that other waiver is merging in two. So it's not the answer I think that they maybe wanted to hear. And we definitely put the web service on there to kind of keep that safety net, on there. But that, like I said, and Jenny, I don't know if this actually helps with your specific situation, but I think ours was similar. That's what we basically ended up telling them.
Yeah, that is exactly where I was at. They want to move to CHCBS. I think I said that wrong, but they want to move to that so they can get like respite, for instance. And then, and I think that was a main thing.
Yeah.
And then if they say their service plan is July 1st, then we would have to transition them back.
Right. And that's what ours was too. It will
Okay.
7/1 start date. And me and Carol just basically said, like, hey, like that's possible. We could do that. But we
Yeah.
don't know how long the waiver to waivers are taking right now. And our kind of fear with technology and all the fun things that happen is like, let's not poke the bear. Let's just like let this merge like happen, and then
Mhm.
like in July we set an appointment to talk to them again, because we also don't know exactly what that IHSS is going to look like in 7/1 either. And like I could do a
Mhm.
revision right now, but I don't know how long it's going to take for it to get approved, and that could mess it
Right.
even more. So we basically just told them, like, if this isn't an urgent situation, let's not poke the bear, let this go through, and then we'll readdress it in July.
Got it. Okay.
Because that HCBS program is coming over too. So
Yeah,
you may or may not be able to reap the benefits of that IHSS for a little bit before the 7-1,
right.
but will you though? You know?
Yeah, I would say, in this situation, I'd recommend they stay on CLLI. Like you said, Jacqueline, I believe Jackie.
Mhm.
Yeah.
So, yeah, because then, at their CSR, they can enroll into IHSS and receive those services, after 7-1. If you were to enroll them into CHCBS now, you'd have to enroll them back before, because you're not going to be able to create a
Right.
CHCBS car for 7-1 and later. So,
Mhm.
I think our recommendation would be the same to keep them on CLLI. If they absolutely need IHSS, though, I mean, feel free to reach out to us separately and we can kind of talk through that case on a more individual basis, though.
Okay. Actually, I do think that their service plan is in October. Their new service plan would be October, so I
Oh,
guess
so
it
their
would be a good
CSR would be
idea to
July and June.
transition to CHCBS, and then in October, then it'll have the CwCHN, right?
Well, remember, CHCBS members are not automatically going to transition to the CwCHN waiver. You have to make sure CHCBS members get enrolled into CwCHN at
Mm-hmm.
their CSR. It's only CLLI members that are going to automatically experience the name change and automatically be in the new waiver.
Okay. So it might be beneficial just to leave it as the CLLI,
Correct,
because it'll switch July 1st.
correct.
And then that CFC is going to be happening July 1st too. So to be honest, Jenny, like you and I aren't even going to be the ones doing the IHSS.
Right.
Whereas I could see it being beneficial to be like grandfathered in, like, oh man, if we could get this in before all this happens, like that would be great. But
Yeah.
unfortunately, because the CHCBS waiver is the one that's actually merging, I don't think it's going to do them any favors because then the agency is going to have to get with this new nursing thing and like it's going to halt it,
Mm,
you know? So
yeah.
we might as well just wait until the July 1st merge actually happens, and then they would just be going through like the normal process or what will be the new normal,
Mm-hmm.
process for doing that anyway. I mean, I did tell mine like, hey, like you're more than welcome to still go ahead and like shop around or, shop around. I'm not supposed to say that, to research, what agency you might want to use, things like that. But yeah.
Got it. That's helpful. Thanks.
Okay, yeah, no problem. Feel free to reach out if you have more questions on that. I will go to the next question here on my screen. Have you considered including home mods as a benefit under the CwCHN waiver in the future? Many children with medical needs require enhanced accessibility at home, and this could greatly improve the quality of their life. So yes, while we agree with you that home mods would be great under this new waiver, we don't have budget authority to do that at this time. So we'll keep it on our radar, but we are not able to add that service onto the waiver for this year. Okay, next question. I have a member on CLLI. Start date 7-1 and 18th birthday is 7-4. We already got her started with, I think that's SLS. I'm guessing it says SIS, but I'm guessing SLS and all that. But would that mean that we don't need to rush into getting them on an adult waiver? So I think if I'm understanding you correctly, yeah, if they're on CLLI, they have until their 19th birthday to transition.
Right. That's why I was asking. So that we started this with them at the last quarterly, so like 2 months ago. And we had them put in their ARG, which was apparently needed and we didn't know it, but she got that in. And then it's, oh crap, you're turning 18 soon on 7-4 and you're a 7-1 start date. So we didn't know about the 19th birthday thing yet. So we went on ahead and requested the SIS assessment, and that's been completed. I just got the results back today. But like this particular person, like I'm calling her back today to talk to her about next steps. And it's kind of like, okay, well, since like, so now we don't need to rush because the 18th birthday is 3 days after the start date and doing that whole fun stuff.
Jacqueline, I'm curious why you're doing assist if this person's on CLLI.
Because they're interested in SLS.
Do they already have a DDD?
ARG,
Nope, a DD, an IDD determination.
yeah.
Okay.
Yeah. They already have the IDD, but the resource exchange anyway version. And then we did get notification from DHS that they needed to submit an ARG. So they got that in. And then we were like, well, we'll go ahead and go along with the CIS. And then like 2 weeks later, we found out that the CIS is getting, demolished, but we'd already put it in, so it got taken care of. And so it's just like now, like, okay, so do we still need to, try to get this rolling for this 18th birthday, or can we kind of relax a little bit?
You guys could relax a little bit and not have to rush as much now that they can wait until they're 19 to fully transition.
Okay.
Okay, thanks, Aubrey, for jumping in on that one. Okay, the next question I have is, this might be a CFC question, but since CDOS and IHSS are going under CFC, does that mean we will no longer need Telgen approval for CDOS and IHSS HMA for adult waivers? So the nurse assessor is going to be what replaces Telgen in terms of skilled care assessments. So, I'm not sure about CDOS and Telgen. I'm not, very well versed on that process. So maybe we wait and discuss this more at the CFC training. But ultimately, for any skilled care, the nurse assessor is going to be the avenue for that service. Okay. And then the next question I have, are there concerns or additional supports in place for any technical issues that may happen when all of these changes happen 7/1? CCM is notorious for making a change and causing issues with other things. I would be concerned that these massive changes cause system glitches that then prevent children being able to receive services. Very good question, and you raise a concern that also keeps me up at night. I am also very concerned. We are doing everything that we can to prevent any sort of CCM malfunction like we've had previously. I think that we'll keep you all updated as we progress this spring, but just know we're planning on, we're doing everything we can to stabilize CCM now and to make the changes as smooth as possible and ensure children don't lose any access to services.
Winter, it looks like you're off mute. Take it away.
Yeah, so my brain with a previous conversation is just trying to wrap its mind around this. As of 7/1, CLLI kiddos will change to CwCHN in systems. But if they are in the middle of their cert or their certification is July 1, 25 through June 30th, 26, we are not able to enroll them in CFC until their new start date, correct?
So if I'm understanding you correct, so for CHCBS members who have a start date 7/1, you'll enroll them into CLLI and CFC at the same time. And we'll get into this more at CFC training, but you'll be able to begin CFC assessments in April as well for members with July 1st cert dates and later.
So what I mean is just CLLI, the CLLI waiver kiddos are kind of automatically being shifted to CwCHN.
Right.
but they will continue on their current services until their next certification date and not have access to IHSS and CFC until that next start date during 25-26 certification, correct?
Correct, yes.
Okay. So
CLLI
it doesn't mean
members-
that it CLLI and it turns to CwCHN on July 1, right? But yes, there's the name change. I'm just making sure that our CLLI families, as well as CHCBS, not to discard them, they don't have access to actual Colorado First Choice benefits until their new certification date that happens between July 1st, 25 and June 30th, 26. They cannot enroll early. They have to have that cert date happen. So they're going to continue with whatever they have. And then at their certification date, you can add those things, correct?
That's correct.
Okay. And if they ask to get in early to anything, there's really no way to do that. That's also it's kind of a CFC question, but it's
Yes.
a question, but okay.
No, it's a good question. At this time, to help you all manage your workloads and to not overload the system, we are really trying to communicate to members that they can only enroll at time of CSR unless they really have a change in need or condition and they need a service that is on CFC. More guidance around that is coming in the CFC training. We'll be able to kind of more definitively answer those questions with some different scenarios, but yes, the short answer is yes, they have to wait. All right. Amanda, is there anything else? I'm not seeing anything else in the Q&A.
No, nothing in the Q&A. Hands up right now. We're at 1:09, so we've got about 21 minutes left. Otherwise, it looks like people are already jumping off.
Okay.
Thank you, everyone.
Yeah, thank you so much. We'll continue these conversations in the training for CFC. So if something comes up and you have a question, you can feel free to ask during the CFC training, as these projects are very linked. So yeah, we look forward to seeing you in a couple weeks.